Blood labs for hormones fail for most women in finding the root cause of what's going on and if they actually have a hormone problem. The problem with the blood labs for hormones is that they don't give you a good idea on what's actually happening in the tissues in the active forms of the hormones, which is what you get from saliva testing. At the same time, they also aren't telling you how you're metabolizing your hormones, which is a very important factor for how those hormones are affecting your body. For example, when you are breaking down estrogen in phase 1 of detoxification, you're going to be creating 3 different metabolites. One is 16-hydroxyestrone, 4-hydroxyestrone, and 2-hydroxyestrone. And depending on what you are producing more of, you're going to have a good experience with your hormones or a bad experience from your hormones. 16-hydroxyestrone is a metabolite that is actually very active on the estrogen receptors. 4-hydroxyestrone is a very reactive metabolite, meaning it is a reactive oxygen species and it creates DNA damage. So for both 16 and 4-hydroxy, when we talk about things like breast cancer or autoimmune disease, if you are producing more of these things, typically you're going to have more issues with those types of problems. However, if you're producing 2-hydroxyestrone, you are going to have a much more positive experience because that is much less estrogen active and it is less reactive as far as inflammation or dysfunction in the DNA. So if your hormone levels are normal, but you don't feel normal, especially with your cycle and your periods, then you need to do further testing to really confirm, is it coming from my hormones or is it actually something else?